This morning on The Blend, we are joined by Laurel Oppel, who is the Executive Vice President of the Michigan Health and Hospital Association. Thanks so much for joining us.
Thanks for having us here.
I want to ask you, with the proposed federal Medicaid cuts, what is going to be the impact for hospitals and healthcare providers across Michigan, particularly in those rural and underserved communities?
So Medicaid cuts of the proportion they're speaking about at Congress are huge, devastating, and they're going to affect every hospital and I would say professional clinician in Michigan. But for our rural hospitals in particular, there isn't a lot of room for give. They're not highly capitalized. Their fixed costs are large compared to their population. And we know from some research that I learned about at the University of Michigan that there are as many as 20 rural hospitals that are already financially stretched. So there's no room for further cuts. They're financially stressed before any of these things happen.
Right. Laura, talk about some of the consequences of Michigan families, especially children, seniors, and people with disabilities. What's going to look like if Medicaid funding is capped or reduced?
Yeah. So cutting funding is cutting access to care because you just can't do all of the things you're doing now with fewer dollars. And when we talk about cutting funding and potentially taking things offline like a labor and delivery unit in a rural hospital or inpatient psychiatric care, again in a rural hospital where there's very little flexibility, when those services have to close because they might put the whole hospital at risk of closure if they continue, they're closed for everybody. These aren't cuts to people who use Medicaid as their insurance. Those would be service losses, loss of access to care for everyone. It doesn't matter which insurance card you have. If nobody's delivering babies at your local hospital, they're not delivering babies. It's just, you'll have to go elsewhere.
And when you think of the broader implications, that's huge. You think of job losses, and talk about that a little bit.
Yeah. So hospitals now, as someone said to me the other day, it didn't used to be this way, but hospitals now are the largest employer in many of the communities where they're located. Nearly every rural county that has a hospital, that's the largest employer. So if you take a lot of funding out of that employer, it's going to force cutbacks. It's going to make a difference economically, not just to people who might lose their jobs, but also in terms of if you have to drive past your rural hospital to go somewhere else, you're going to drive past the local businesses as well.
Well, thank you for drawing attention to it, and we've got your information on the screen.
Terrific, thank you.